Hello everyone, now let us discuss about the brief summary of adrenergic drugs. In the current session, we will be focusing on the agonist and antagonist. Now coming to the first drug, that is noradrenaline or norepinephrine. It is alpha and beta agonist. It is used for hypotension in intensive care units, and it acts as a transmitter at postganglionic sympathetic neurons and in CNS. Unwanted effects are hypertension, vasoconstriction, tachycardia or reflex bradycardia, ventricular dysarrhythmias. These are some of the unwanted effects of noradrenaline. Coming to the pharmacokinetic aspects, it is poorly absorbed by mouth, rapid removal is seen in tissues, and it is metabolized by MAO and COMT. Plasma half-life is 2 minutes. The next drug is adrenaline or epinephrine. It is also alpha and beta agonist. It is used, coming to the clinical uses, it is used anaphylatically, it is used to treat anaphylactic shock, cardiac arrest, and it is added to local anesthetic solutions. Main hormone of adrenal medulla. Adrenaline is the main hormone of adrenal medulla. It is used to treat anaphylactic shock, cardiac arrest, and it is often added to local anesthetic. Unwanted effects are similar to that of norepinephrine, that is nothing but hypertension, vasoconstriction, tachycardia or reflex bradycardia and ventricular dysarrhythmias. Coming to the pharmacokinetic aspects, it is similar to norepinephrine given intramuscularly or subcutaneously. IV infusion in intensive care settings also is given. The next drug is isoprenaline. It is beta agonist but it is non-selective. It is used to treat asthma. Now it is obsolete. Unwanted effects are tachycardia and dysrhythmias. Pharmacokinetic aspects are some tissue uptake is seen followed by inactivation by COMT. Plasma half-life is 2 hours. Now it is replaced by salbutamol in the treatment of asthma. Previously isoprenaline is used to treat asthma, but now it is replaced by salbutamol. The next is dobutamine. It is beta-1 agonist. Dobutamine is beta-1 agonist. It also has weak beta-2 and alpha-1 activity. And it is cardiogenic. Unwanted effects are dysarrhythmias. Plasma half-life is 2 minutes and it is given intravenously. The next drug is salbutamol. It is a beta-2 agonist. Dobutamine is beta-1 whereas salbutamol is beta-2 agonist. It is used to treat asthma and premature labor. Unwanted effects are tachycardia, dysrhythmias, tremor, peripheral vasodilation. Pharmacokinetic aspects are it is given orally or by aerosol, mainly excreted unchanged. Plasma half-life is 4 hours. The next is salmeterol. It is also beta-2 agonist. It is also used to treat asthma, and unwanted effects are similar to that of salbutamol. They are tachycardia, dysarrhythmias, tremor, peripheral vasodilation, and it is given by aerosol. It is long acting. Formoterol is also similar to salmeterol. The next is terbutaline. It is also a beta-2 agonist. It is used to treat asthma and delay of parturition. Unwanted effects are similar to that of salmeterol, and pharmacokinetic aspects are it is poorly absorbed orally, given by aerosol and mainly excreted unchanged, and T half is 4 hours. Next is clenbuterol. It is also beta-2 agonist and it is anabolic action to increase muscle strength. It is used to increase the muscle strength because of its anabolic action. Clenbuterol. Unwanted effects are similar to that of salbutamol and it is active orally. Previous beta-2 agonists, they are poorly absorbed orally, whereas clenbuterol is active orally and it is long acting. And it is used as illicit drug in sports because it increases the muscle strength. It is used as a illicit drug in sports. The next is mirabegron. It is also beta-2 agonist. The symptoms used to treat symptoms of overactive bladder. Mirabegron. Unwanted effects are tachycardia and this is also active orally and given once daily. The next is phenylephrine. It is alpha 1 agonist. Phenylephrine is alpha 1 agonist, whereas terbutaline, clenbuterol, and mirabegron are beta 2 agonist. Coming to phenylephrine, it is alpha 1 agonist and it is used to treat nasal decongestion. Unwanted effects are hypertension, reflex bradycardia. It is given intranasally, metabolized by MAO, and it has a short plasma T-half. The next drug is methoxamine. Main action is alpha agonist and it is non-selective. It is also used to treat nasal decongestion. Unwanted effects are similar to that of phenylephrine. It is given intranasally and plasma T-half is 1 hour. The next is clonidine and lofexidine. It is alpha 2 partial agonist. Clonidine is alpha 2 partial agonist. Uses are, it is used to treat hypertension, migraine, prophylaxis, vasomotor instability, which is nothing but hot flushes. Lofexidine is used to reduce symptoms during opioid withdrawal. Lofexidine is a alpha 2 partial agonist and it is used to reduce symptoms during opioid withdrawal. Lofexidine. Next, coming to unwanted effects of clonidine and lofexidine are drowsiness, hypotension, edema, weight gain, rebound hypertension. Coming to the pharmacokinetic aspects, it is well absorbed orally, excreted unchanged, and as conjugate plasma half-life is 12 hours. And these drugs are also, they have a illicit use in sports, clonidine and lofexidine. The next drug is phenoxybenzamine. It is an alpha antagonist. It is non-selective and irreversible and it is uptake 1 inhibitor. Phenoxybenzamine is non-selective irreversible antagonist and it is uptake 1 inhibitor. It is used to treat pheochromocytoma. This is a hormone secreting tumor that can occur in adrenal glands. Unwanted effects are postural hypertension, tachycardia, nasal congestion and impotence. Pharmacokinetic aspects are absorbed orally, plasma T-half is 12 hours. And the action outlasts the presence of drug in plasma because of covalent binding to receptor. The action outlasts the presence of drug in the plasma because of its covalent binding with receptor. The next is phentolamine. It is alpha antagonist, non-selective vasodilator. It is rarely used. Side effects are similar to that of phenoxybenzamine and pharmacokinetic aspects are usually given intravenously, metabolized by liver. Plasma T-half is 2 hours. The next drug is prazosin. The main action is it is alpha 1 antagonist. It is used for hypertension and the unwanted effects are similar to that of phenoxybenzamine, absorbed orally, metabolized by liver and plasma half-life is 4 hours. Doxazosin and terazosin are similar drugs to prazosin, but they are long-acting. Doxazosin and terazosin are long-acting, whereas prazosin is short-acting. Next is tamsulosin. It is alpha 1A antagonist and it is uroselective. It is mainly used to treat benign prostatic hyperplasia or prostatic hyperplasia, BPH. And unwanted effects are failure of ejaculation. Pharmacokinetic aspects are it is absorbed orally. Plasma T-half is 5 hours. Next is it is selective for alpha 1A adrenoceptor. Tamsulosin is alpha 1A antagonist. It has selectivity for alpha 1A receptor. The next is yohimbine. It is alpha 2 antagonist. It is not used clinically, claimed to be aphrodisiac. And unwanted effects are excitement and hypertension. Absorbed orally, metabolized by liver. Plasma half-life is 4 hours. Yohimbine is alpha 2 antagonist. Tamsulosin is alpha 1A antagonist and prazosin is alpha 1 antagonist. Now coming to beta adrenoreceptor antagonist. First one is propranolol. It is beta agonist and it is non-selective. Uses are it is used in the treatment of angina, hypertension, cardiac dysrhythmias, anxiety, tremor and glaucoma. Unwanted effects are bronchoconstriction, cardiac failure, cold extremities, fatigue, depression, hypoglycemia. Pharmacokinetic aspects are it is absorbed orally, extensively first pass metabolism, about 90% bound to plasma proteins. Plasma T-half is 4 hours. Notes are Timolol is similar and used mainly to treat glaucoma. Timolol is similar to propranolol and it is mainly used to treat glaucoma. Next is alpranolol. It is beta antagonist. This is also non-selective and it has partial agonist activity. Uses are similar to that of propranolol, that is used in angina, hypertension, cardiac arrhythmias, anxiety, tremor and glaucoma. Unwanted effects are also similar to that of propranolol. It is absorbed orally, metabolized by liver and plasma D-half is 4 hours. Oxprenolone and pindolol are similar to that of alpranolol. The next is metoprolol. It is beta-1 antagonist. Propranolol is non-selective, whereas metoprolol is beta-1 antagonist. Uses are angina, hypertension and arrhythmias. Unwanted effects are similar to that of propranolol, less risk of bronchoconstriction. Metoprolol causes less risk of bronchoconstriction. Pharmacokinetic aspects are it is absorbed orally and mainly metabolized in liver. Plasma T-half is 3 hours. Atenolol is similar with longer half-life. Atenolol is similar to that of metoprolol, but it has longer half-life. Next is nebivolol. It is beta-1 antagonist, enhances nitric oxide synthesis. It is used to treat hypertension. Unwanted effects are fatigue and headache. It is absorbed orally. Plasma T-half is 10 hours. The next drug is butoxamine. It is beta-2 selective antagonist. Nebivolol, metoprolol, atenolol, all are beta-1 antagonists, whereas butoxamine is beta-2 selective antagonist. It does not have any clinical use. Now coming to mixed alpha-beta antagonist. Labetalol, it is antagonist of both alpha and beta. Uses are it is used to treat hypertension in pregnancy. Labetalol is the antihypertensive drugs that is used in pregnancy. Unwanted effects are postural hypertension and bronchoconstriction. Pharmacokinetic aspects are it is absorbed orally and conjugated in liver. Plasma T-half is 4 hours. The next drug is carvedilol. It is beta and alpha-1 antagonist. Mainly used to treat heart failure. Unwanted effects as that of other beta blockers. Initial exacerbation of heart failure and renal failure may also result. Absorbed orally, plasma T-half is 10 hours. Some of the additional actions may contribute for clinical benefit of carvedilol. The next is drugs that release non-adrenaline, indirectly acting sympathomimetic amines. First one is amphetamine and next is ephedrine. Coming to amphetamine, the main action is noradrenaline release, MOA inhibition and NET inhibitor. NET is nothing but norepinephrine transporter. It is also CNS stimulant. Amphetamine is a CNS stimulant. Uses are used as CNS stimulant in narcolepsy, also paradoxically in hyperactive children. Appetite suppressant drug of abuse. Amphetamine is a drug of abuse. Unwanted effects are hypertension, tachycardia, insomnia, acute psychosis with overdose and dependence. Pharmacokinetic aspects are it is well absorbed orally, penetrates freely into brain. It crosses blood-brain barrier, excreted unchanged in urine. Plasma T-half is 12 hours depending on urine flow and pH. Notes are methylphenidate and atomoxetine are similar and used for CNS effects. The next is ephedrine. Main action is NA release, beta agonist, weak CNS stimulant action. It is used to treat nasal decongestion. It is used as nasal decongestion. And as amphetamine, side effects are similar to that of amphetamine but are less pronounced. Pharmacokinetic aspects are also similar to amphetamine. And ephedrine, it interacts with MOA inhibitors. Thank you for watching. Please subscribe for further videos on pharmacology and related pharmaceutical sciences.